Hi there everyone, it's Ryan Liberty. In this video, I'm going to answer the question, what is EMDR?
Ooh, ah.
Okay, so let's get into what EMDR is. EMDR actually stands for Eye Movement Desensitization and Reprocessing. And it's a form of therapy, and I'll have to refer to my notes here. I always take notes before these videos to make sure I get it right. But it's a form of therapy that's meant to be short-term, and it is something that was developed specifically to help people who have traumatic memories and people who are going through things like traumatic disorders such as PTSD. So it is meant to access and reprocess those traumatic memories. And it does this, what it does, the outcome of EMDR is that it alleviates stress, it alters any of the negative beliefs that we typically find when somebody's gone through a traumatic event, and it reduces the person's overall arousal. You know, as we get something like PTSD, our arousal level naturally heightens and we become a little hypervigilant, so EMDR will help to lower that, take away some of the stress, and get us to start thinking a little bit more positively about ourselves, because trauma often makes us feel crappy about ourselves. So generally, because it is a short-term treatment, generally, and this isn't true for everybody, so don't quote me here, but generally you can see a good reduction of symptoms within 12 sessions. And EMDR generally has 8 phases that you go through. So phase number 1 would be and this is just kind of like what it would look like when you go into the therapy. So phase 1, which could be 1 or 2 sessions, is just like a history taking. So you kind of inventory all of the traumatic memories that you have to kind of figure out, like, what is the plan going forward here? What are the memories that you want to process? And how are we going to handle it? Kind of like an introduction to what EMDR is in those sessions. Then the second phase is teaching of stress reduction techniques, and that can be anywhere from like 1 to 4 sessions. And you're going to need the stress reduction techniques a little bit later on in the therapy. So the third phase here is assessing traumatic memories, visual memories, the negative thoughts associated with those memories, and the feelings in your body that come along with them. So, you know, if somebody experienced something horrible that was done to them, you would discuss what is it that you visually remember about that? What is it that you feel about yourself? Maybe you feel like a disgusting person, so that would be something that you would note down. And then what does it feel like in your body? So you may note that you get like a neck pain whenever you think about that memory, for example. So all those kinds of things would be assessed in phase 3. Phase 4 is the actual, like what people think of when we think of EMDR, eye movement desensitization and reprocessing. So phase 4 is desensitization. And this is the part where the therapist will do something such as taking their finger, or sometimes it's like a light used, and it'll go back and forth in front of you, and you're supposed to track it with your eyes. And as you do that, they do the desensitization process. Sometimes people will also use paddles that you hold on to that have like electric stimulation, or they may ask you to tap like on your knees or something. Everybody does it a little bit differently, but the basic premise is that there is this thing going on here, and the idea seems to be that nobody knows exactly how EMDR works, although it does work. It seems to be that it's related to the way that your eyes move when you sleep during REM sleep. And, you know, when you go through sleep, you process your memories for the day, your body processes them for you, your brain. And EMDR seems to be able to activate some of the pathways in the brain that allow that transaction to happen while you're sleeping, and it gives you access to the memories and the ability to kind of rewrite the memory in your brain. And that's just a very general way of saying it. I'm not like a neuroscientist here, but that seems to be what's going on, and that's what's happening during phase 4, during desensitization. Now, I know if you're using paddles, you're not using your eyes, but it's the same concept of switching back and forth between orientation and processing. So that is phase 4. Phase 5 is installing new beliefs. So these are going to be beliefs that you agreed upon during assessment maybe, and you will install beliefs that will replace all those negative beliefs that you had. And they have to be things that you can believe are true. So you do this after you went through the processing. You feel a little bit different now because you've done the desensitization, and you'll be asked, like, well, what can you feel right now? Like, what can you believe about yourself now that we've done this? And there's a little bit of an installation period to make you start to think the new way as opposed to the old way about your traumatic memories or about yourself. And then we have phase 6, which is to check your physical sensations, just to see, like, how does your body feel, to become aware of that. A lot of times with trauma, we're not aware of how our body feels in the day-to-day, so we bring attention to that in phase 6. Phase 7 is closure, and closure is where we use those techniques that we talked about from phase 2, the stress reduction techniques. And this happens at the end of every therapy session when you do desensitization. They will make sure that you do not leave that room feeling too aroused, too much, and too much stimulation. They want you to leave feeling calm and okay, so that's why you learn those techniques to manage stress, and you use them in phase 7. And then phase 8 is reevaluation. So at the beginning of the next session, you'll discuss, how did things go? How do you feel today? Did it work well? Did it not work well? Maybe you want to retarget the same memory that you did in the last session, or maybe you want to move on to a new target. So that's the kind of thing that you would discuss in phase 8 when we're talking about EMDR. So just a quick little recap, the first couple of sessions are just to do an intake and to gather an assessment of what's going on. And from there, you're going to do desensitization, installing the new beliefs, checking on how your physical body feels, closing at the end of every session, and then reopening at the next session with reevaluation. And again, this is short-term therapy. It should be, 12 sessions. You should start to feel better. It may take a little longer for everybody. I mean, everybody has a different situation, so it may take a little bit longer depending on what your individual situation is. So don't think like you have to have 12, and if it's not working by 12, it's not good. But you do need to give it a little bit of time. And it works. It's amazing. We don't really understand why it works, but it seems to work for many, many people. I will say, before I end this video, I have heard just anecdotally from people that have taken EMDR that when they go to sleep at that night, sometimes they have like nightmares, or things feel very intense. It's something that you can certainly discuss with therapists that you're seeing. But it's just something that I want to throw out there, maybe just to be aware of. It's kind of a normal thing that happens to people. It's thought of that's just the brain using that REM sleep to process what you went over in the therapy sessions. Nothing to be too afraid of. But of course, if it's incredibly distressing for you, you can discuss that with your therapist and figure out what to do in that reevaluation phase. So that is EMDR, eye movement desensitization and reprocessing. If you have done EMDR, if you had good results, bad results, whatever the situation is, I'd love to hear what you went through. So please comment down below and let me and everybody else know. And I thank you, of course, as always, for joining me to learn about EMDR. Hey, it's Ryan Liberty. If you liked that video, please give it a thumbs up, share with a friend, and leave any questions or comments down below, because that would really help me out. If you're somebody who's gone through a traumatic event and you're feeling cut off from the people around you, I have a free course that will help with that, so please click to get it. And if you'd like to see the rest of my videos, please click subscribe. As always, I want to remind you that your life matters. Nobody can question your worth. However it is that you're feeling, whatever it is that you're going through, it's okay, and you are loved. Thanks again for watching.